Thanks for inviting me. Good afternoon. Yes, it's a little bit better than last year. Well, is there anyone who could help me to put my slides to the screen? Yeah, that's fine. Thank you so much. Well, I'm a health economist by training and practice, and at the moment I serve as an influencer. This means I give advice to each and every decision maker that is interested in hearing what I have to say. In former years, I worked as a coordinator for in- and outpatient mental health services for Lower Austria. Lower Austria is an Austrian province with roughly 1.6 million inhabitants. At the moment, I also serve the Lower Austrian government. I'm a member of the board of the Lower Austrian hospitals and long-term care facilities. Well, I have different approaches. I'm not a physician, as I mentioned before. I'm an economist and I'm an influencer. Therefore, each and everything, very relevant things, and I'm so glad that I had the opportunity to hear all this good information. Each and everything that is relevant has been said. My message is, how can we put the rubber on the road? Because it is about how can we make harm reduction a little bit more attractive even in Europe and in particular in Austria. That's what I'm trying to tell you. Well, this is my conflict of interest statements. There is no conflict of interest at all. Yes. That funny picture describes what I'm going to do. Of course, it would be the best not to smoke and not to drink alcohol. But what is the second best? What is the choice? What is the option? That is the whole story. The problem overview, it's more or less clear. We have different types of drugs. We have illicit drugs or illegal or legal drugs, but the border is not that clear, and some of you mentioned it in a quite funny way today in the morning, that we all drink coffee, and the WHO has also coffee on its list. It's a drug, but therefore we have to be a little bit more relaxed, and we should keep our eyes on what is feasible and what is more or less impossible to reach. Therefore, when we talk about legal drugs, what is legal, what is illegal, and we had also a discussion about cannabis, for example. Different European countries have the discussion to legalize or more or less legalize cannabis, and I also talked about caffeine. What we do see is some kind of religious wars when it comes to tobacco. It is more or less, even in the scientific community and for physicians, it's more or less accepted that we have some kind of harm reduction concerning illegal drugs and even alcohol. There are some physicians here in the room, I know that, even from Austria, and it is more or less a standard procedure to bring patients to drink less than more, for example. It's more or less accepted, but things are also questioned at the moment, and the colleague from Ireland or from Scotland, I'm not so sure, she told things are changing, and we have different politicians who are not that happy about having harm reduction any longer. Therefore, what has been clear for some years may be under stake at the moment. Well, we have, and it's part of the religious war, it's not my idea to label it that way. It is from Alfred Uhl. He's a colleague of mine. He's an expert from Austria, and he he gave a presentation for the German Gesundheitsausschuss, for the German parliament. And what you see is we have a restrictive approach, and he brought it together with some religious ideas that we find this restrictive approach more or less in Protestantic countries or Calvinistic countries. That's more or less true, but not in each and every case. When we regard the United States, we see some funny exemption of that. The restrictive approach, quit or die, will note it, or the liberal approach. This means that we should empower the people to take care for themselves and, for example, to consume alcohol responsibly. High alcohol prices, and we had the discussion, what is the difference between the Scandinavian countries and the countries, Spain, Italy, or France. You all know the French paradoxon. They eat butter, they eat white bread, they drink red wine, and they are more healthier than the average. It wasn't for many years. Nobody talks any longer about the French paradoxon, but we had it some years. Well, high alcohol prices, this means, should we impose taxes? But what is the result of imposing high taxes on spirits, for example? Would the people drink less, or would they circumvent or use the other ways to get what they want? For example, in the Scandinavian countries, they take a boat, they go outside to the duty-free regions of the sea, and they come back. This means there are strategies to circumvent all the restrictions, and therefore we should be very careful in discussing that kind of stuff. Other restrictions in the availability, we all know this from the United States. I'm a graduate of the University of Toronto, and I had some semesters at the University of Atlanta, the Emory University, and I know what restrictions is. You all know this brown paper bags, and on Saturdays and Sunday you can't buy any liquors in some stores or whatever. And even restrictions on the marketing. But the question is, can we control even the marketing efforts made by some companies, for example, because we do not rely any longer on TV or movie theaters. We have social media. You can't control that. It's more or less useless to do that. Well, the liberal approach, we shouldn't apply restrictive measures in general. Sometimes it would be quite useful. Therefore, and I tell you now who is the murderer, it is a good blend, it is a good mixture of different strategies and approaches. We should have different methods and techniques focus on sobriety, and that worked. I'm also responsible. I'm head of the department at the Chamber of Labor of Austria, and occupational safety and health matters are also part of my daily work. And what we did see, even in the earth-moving industry, bricklayers and so on, in the 1970s and 80s, they drank beer. They worked they worked and they drank beer. What do we see now? They drink mineral water. Different other efforts to strengthen the persons and to help them to choose good choices. Well, the Nuffield letter, and this is on the bottom line, what I'm trying to say is, we need a synthesis, we need a set of different keys, and we should discuss what is applicable and what is acceptable on the national level, because we have different cultures. Some like to drink red wine, some like to drink liqueurs, some like to consume very fat food, for example. What can we do? And you all know the Nuffield letter, and we see different steps and different keys we should apply on that. Well, because I'm running out of time, I will skip all over that. This is all more or less clear for you, and I'll turn to the cigarette issue. And is it still quit or die, or what can we do? As I mentioned before, tobacco harm reduction is a thing. For example, in Austria, it's very, very hard to put harm reduction issues on the agenda of the political decision makers. They don't like it at the moment. They don't like it at all. And they are not interested in hearing arguments. They just refuse to put it on the agenda. That's the thing. Which different opportunities are delivered by the industry, we have just told about it. And that's remarkable because when talking about a Calvinistic country, the United States, the FDA has already acknowledged that there are some benefits in applying snus. The FDA is much more open-minded to that option than we see the situation in Austria. And please apologize, the next slide is very rude, but that's what we see in Europe at the moment. And that's not very helpful. We should have a dialogue, and it should be taken serious. It is not about fun, it is not about condemning different options. Yes, well, what about, let's stick to this news topic. It is not healthy, it is less harmful than smoking cigarettes, and we have some risks associated with snus concerning oral health problems, cancer risk, cardiovascular health problems, type 2 diabetes and pregnancy-related risks. We all know that, but on the bottom line, and you know I'm an economist, on the bottom line this is it more harmful or is it less harmful, and what could be the benefit for the individual as well as for the community, for the state as a whole, and for the public budgets. And on the bottom line we have to say alternatives to the classic cigarette are considerable, useful, and we should give a boost, and we should support, and we should help researchers to do steps in the right direction so that we can generate evidence. Because most of the evidence we use nowadays is generated by organizations that are funded by the tobacco industry, and therefore there is a mark on it. Oh, you couldn't use the data because it's financed by the tobacco industry. Nobody would use that argument concerning legal drugs. Of course, drug companies finance different studies, and we shouldn't use that any longer. Of course, we should take into consideration there may be some conflict of interests, but we should take that into consideration, but we should take what we have and we should go a little bit further. Well, I'm finished.